back to Tuesday Tips. This is our weekly check-in. We discuss topics in plastic surgery and I get to answer your questions. Happy Valentine's Day. Hope you enjoy your day with your loved ones. Whoever it is, your dog, your cat, your mom, your neighbor, whoever it is. Have a beautiful day. Eat the chocolates today. Tomorrow we can be on the diet. Today we're going to be talking about muscle repair, okay? Muscle repair, what are the benefits, who is the candidate, and then we'll take some questions, okay? So let's start with the anatomy, the abdominal wall anatomy. There are a couple of muscles in our abdominal wall, okay? So the muscle repair, it basically brings the two muscles in the center, which are the rectus abdominis, back to the center. So let's talk about the anatomy and then we'll talk about diastasis, or what happens with the separation. So the abdominal wall has mainly pair of muscles, okay? So the same that we have on one side, we have on the other. There's a pair of muscles in the center, which are called the rectus abdominis muscles. Those are divided in the midline by the linea alba, or the center line that forms in the middle of these two muscles. And the rectus abdominal muscles are the common abdominal muscles that we call the six-pack muscles. And the reason for that is because they're divided by these bands of tissue that makes these muscles, when we work out and we strengthen them, to create those little boxes, and that's why we call it the six-pack, okay? So we have those two pairs of muscles which are in the center, and the other three muscles are on the sides, and they basically come in layers. So we have the oblique muscles, which are the ones that are from the outside in. We have the external oblique, then we have the internal oblique, and then the transversus abdominis. Those muscles basically wrap our torso, connecting from the back, the spine, the ribs towards the middle, and connect to the linea alba. They basically anchor our ribs and our pubic bone and basically stabilize our torso, okay? So that's why when we're talking about core exercises, it's not only working out those rectus abdominis muscles, also it involves working out the entire abdominal wall, the rectus, the obliques, and the transversus abdominis, to create that stability, okay? What happens when we have an increase in the abdominal pressure? So whenever we have an increase in the abdominal volume, the two most common reasons are pregnancy and weight gain. Anything that distends or expands that abdominal wall, it creates a separation in these two muscles. Doesn't happen to everyone. There's a genetic component to it, and also it has to do with your level of tone of those abdominal muscles before your pregnancy. If you are a person that worked out a lot and they have more support, then they can sustain more that increase in the volume of your abdominal wall. But if you never worked out and that those muscles were weak to begin with, anything that increases that space, then it's going to stretch them more. So what happens? Then we can end up with what's called a diastasis. And there's actually people that have diastasis just genetically. Just your abdominal wall developed this way, okay? And actually babies always have a degree of abdominal diastasis, okay? So that is while they start to kind of crawl and develop that strength of their abdominal wall, this improves. But if it's very common that you see in babies when they're moving that they bulge in the middle, because that's still developing. So there are some people that even after they develop and increase their tone, they still have some diastasis. So this is what happens with a diastasis. The linea alba is usually very thin and the muscles are together in the center. But whenever you have that increase in the abdominal cavity and either the pregnancy finishes or you have weight loss and you lose a lot of that visceral fat and weight, then sometimes these muscles don't come together like they were before, and they stay separated in the center, okay? So there's still a fascia, or that layer of thick tissue connecting the muscles. So it's not a hernia. A hernia is when you have a hole, something that fascia has a defect, okay? With the diastasis, there's no defect, there's no hernia, it's just stretched, okay? So it's similar to if you get an elastic band and you stretch it to the limit and it doesn't come back to its original shape, it kind of is still loose. So that's what happens with the abdominal wall, okay? So diastasis is a medical term of that muscle separation. So who is a candidate for a muscle repair? So people that that's why it's important to wait at least 6 months after your pregnancy, and weight loss at least 6 months after your massive weight loss surgery, or 6 months of stable weight. Those reasons are to leave time for your body to kind of restore its baseline, okay? But if you went back to that baseline and you still have that muscle separation, then yes, you're a candidate for muscle repair, okay? The muscle repair, what it does is to bring those two muscles back to the midline, okay? That is going to have several effects in your torso. One is it's going to bring your belly in and flatten your belly, okay? There is still a component of the visceral fat, which is important to understand. So remember, you still have fat on the inside. So if your BMI is still high, it's better to lose the weight before. So this component of visceral fat decreases, and then I can tighten your muscles more, and that's gonna flatten your belly more after the surgery, okay? So the muscle repair is gonna do flatten your belly, okay? Restabilize your core. So a lot of people tell me, now I can do workout better. Now I can do crunches and I have a straightened abdominal wall. Because when you were doing crunches before, those muscles were separated and were working in an angle that it's not meant to be. When those muscles are brought to the middle, then you can exercise and do more core work exercises and straighten your abdominal wall, okay? And it also cinches your waist. It's like a corset, right? If this is separated, then your waist, and that is a very common thing I hear after the pregnancies. Women are like, I used to have a thin waist and now I feel I'm square. And that has to do with that muscle separation. It kind of broadens your waist. Whenever I do the muscle repair, it kind of cinches it in like a corset, and that accentuates your waist and brings it in, okay? And I'll show you a little video I took in the operating room of the muscle separation. I just completed. I'm gonna mute myself because I'm talking over. But you can see that repair. So I basically marked the two areas of the abdominal wall, and I repaired the muscle. This is half of the repair, okay? So this repair is from the xiphoid to the belly button. And you can see there where I tighten that and bring those two muscles back to the midline, okay? I still had to do the bottom. I did it afterwards. I didn't forget. I did it afterwards. This is just a representation with the muscle repair on the top, okay? So who is a candidate? Muscle separation usually is pregnancy and weight loss. The two most common things, but also some people that have it genetically, okay? And it cinches the waist, flattens your tummy, and brings those muscles in, okay? I'll take some questions now, see if you have them.
Yes, we have. Okay, let me pick first those of the topics, okay? Yeah. First of all, what happened if I get pregnant after the muscle I get repaired?
Yeah, that's a very good question, and it's a very common concern for patients that they still want to have kids, or they're still unsure to have or not have the tummy tuck. So the problem with getting pregnancy or gaining a lot of weight after the muscle repair is that it may happen the same thing. It may stretch that repair, and you may need a muscle repair afterwards again, okay? So whenever I have patients that are still thinking about having another baby, my advice is to wait and to have the tummy tuck after you finish with pregnancy, because you may have that repair stretched again and have to do it again.
Okay, and the same okay, how long should I keep the binder before switching to a faja?
Yes, Very good question. The binder, you're gonna use it until the drains are out. So for a tummy tuck, I put drains in, okay? I put them on the sides of the incision. So you're gonna have two drains when you come out of surgery. So you can't really wear a faja with the two drains in. So that's why I put you in a binder. The binder, you're gonna use day and night until the drains come out. Usually the drains come out between 2 to 3 weeks, okay? So once that comes out, then you can switch to a faja, and you're gonna use a faja 23 hours a day for the first 6 weeks, and then from 6 weeks to 3 months, you're gonna use it for 12 hours a day.
Okay. Every tummy tuck needs a muscle repair?
Almost every tummy tuck. So for a regular tummy tuck, for an extended tummy tuck, all of those cases are going to benefit from a muscle repair, and it's a very important component of the tummy tuck to flatten the tummy and also cinch your waist, okay? The only tummy tuck that does not include a muscle repair, actually two types of tummy tucks, is the mini tummy tuck, because the mini tummy tuck only takes care of loose skin below your belly button. So it's for a very specific candidate that only has a little bit of loose skin, but the belly button is still not hooded in place, and the skin over the belly button is tight. It's just a little pouch of skin on the bottom. So it's just excising that skin. And on a reverse tummy tuck. So it's basically the same case, but reversed. The reverse tummy tuck takes care of the skin above the belly button, but nothing below the belly button. So if you're very tight, I see a lot of patients that are candidates for a reverse tummy tuck are actually patients that had lipo and had a little bit of hooding over the belly button, but all of this is very tight. Then we can do a reverse tummy tuck, pull the skin up, and the reverse tummy tuck incision is hidden below the breast, but that does not include a muscle repair.
Doug, how long after a tummy tuck can you stop wearing your faja?
So you're gonna wear your faja for a total of 3 months, okay? The first 6 weeks is gonna be day and night, and from 6 weeks to 3 months, you're gonna wear it 12 hours a day. You choose if you wanna wear it during the day or during the night. It's up to you, but at least wear it 12 hours a day until you're 3 months out.
Okay, how long after surgery is recommended to start the post-op care with lymphatic manual drainage? Sorry,
Yes.
misspelled.
That's okay.
Lymphatic.
Lymphatic, yes. So lymphatic drainage massages are important to start the next day. So I recommend my tummy tuck patients to start as soon as the next day, okay? Usually you're not gonna need as many as with a lipo 360 or a BBL because of the extent of liposuction is not as much. So I usually recommend at least 10 in the entire post-op course for a tummy tuck, but yeah, you start the next day, and usually for the first 5 to 7 days, you're gonna be getting them once a day, okay? But for the first 2 weeks, only in the areas of liposuction, okay? Which is gonna be the flanks and waist, not in the areas of the incision until 2 weeks out to have that wound straightened before applying pressure to it.
Is dual implants better?
So dual implants, I bet you mean the dual plane technique for implants. Those I usually use. So dual plane, what it means is you're putting the implant below 2 planes. That's why it's called dual plane technique. What are the 2 planes? Behind the muscle and behind the breast tissue. So it involves separating the pectoralis muscle a little on the inferior aspect. So the muscle raises a little bit, and when you put the implant, the superior part of the implant is going to be below the muscle, and the inferior part of the implant is going to be below your breast tissue, okay? So that's what dual pocket or dual plane means. I do use a dual plane technique when I'm doing a mastopexy combined with implants, okay? And for some breast augmentation patients, depending on the degree of ptosis or droopiness, okay? For the majority of straight breast augmentation without any droopiness, just adding volume, I usually put the implant under the fascia, okay? I don't raise the muscle. The benefit of that is less pain and less risk of animation deformity. Animation deformity is when you're moving your arm, the implant moves because it's under the muscle, okay? That is why I don't use under the muscle technique. For a straight breast aug, I put it under the fascia. That's the benefit.
Okay. For the muscle repair, when you pull the muscle together, is it being sewn together or how is it completed?
Yeah, so you see it in this little video, you can see how it's basically a suture. I saw it together, and you can see the sutures before I pulled them. That strings blue are the sutures, and right there, they're not pulled together, and in a bit, right, when I start pulling them, you see how the muscles come together, okay? So those sutures are, after I finish this part, I did the inferior part, and then I suture it in the bottom to create a corset and bring those two muscles back to the center.
Okay, Dr. Vidal, how long a tummy tuck takes to heal?
A complete healing of a tummy tuck is going to take a year, but you don't have to be at home healing for a year. Don't worry about that. So it takes different stages of healing, okay? So the recovery, the first week is going to be the one that's going to require you to be resting more. You're going to need more help from a caretaker in terms of moving around, doing stuff, no heavy lifting, no exercises, okay? So the first week, you're gonna need more help. The first 2 weeks, you're gonna still be a little slow. At 2 weeks, you're gonna feel a lot better, but you're still healing, okay? So I always tell my tummy tuck patients, when I see them on day 5, they're like, I'm feeling a lot better. And by 2 weeks, you're like, I feel a lot better. But still, that muscle repair is very young, and those incisions are still healing, okay? So you still have to be resting in terms of no exercises, okay? Walking is fine, and you're gonna be walking from the day of surgery, but no heavy lifting or exercising for a total of 6 weeks, okay? No more than 10 pounds for 6 weeks, okay? Heavy lifting, okay? So after that, after those first 6 weeks, you're gonna feel a lot better. You're gonna be able to go back to the gym. You're gonna be able to start working out, doing stuff at home, but still you're gonna be healing, okay? There's gonna be swelling. The swelling still by 6 weeks is going to be a lot better, but you're still going to see fluctuations in swelling, okay? There are going to be days that are going to be more swollen, still days are going to be a little better, and goes and that back and forth. At 3 months, you're going to see almost close to final result, but the swelling may still linger until 1 year.
Doctora, ¿usted habla español?
Sí. Sí, señor.
Ok, y la pregunta en español
Dígame.
es, ¿qué pasa con los hilos?
Los hilos de la sutura que utilizo, esa sutura se absorbe, pero tarda 9 meses o 1 año que se absorba. ¿Por qué tarda tanto? Porque yo quiero que se forme un tejido de cicatriz fuerte para que esa reparación sea permanente, ¿ok? Hay personas que utilizan suturas no absorbibles, pero a mí no me gusta utilizarlas porque pienso que no es bueno dejar suturas que no se absorben en el cuerpo tanto tiempo ahí, ¿ok? Por eso yo utilizo ese tipo de sutura que se llama PDS, es una sutura que es lo que le llaman long absorbing, tarda muchísimo en absorber, se absorbe, pero tarda mucho para que le dé tiempo al cuerpo a formar ese tejido de cicatriz fuerte y que no necesite más la sutura. Ahora en inglés.
Sorry.
Después de toda esta explicación,
Yeah.
seguro que sí. So the question was if the suture was absorbable or it stayed there, or what is it from? So the suture that I use for that muscle repair, it's called a long absorbable. So it stays in the body for 9 months to a year, but the body absorbs it at the end. Why so long? Because I want the body to create a very strong scar tissue in that area. So it's still a strong repair, but that you don't have permanent sutures there for life.
Do you perform rhinoplasty?
I do rhinoplasties. Rhinoplasty surgery is very transforming surgery for the face. The nose is literally the center of our face. That is the anatomical position of the nose, so it's a very noticeable area. And what are the areas that usually improve or we can target with a rhinoplasty? The dorsum is a very common area that if you have a dorsal hump or a protuberance in the hump, especially in the side view, it's an area that we can definitely improve with a rhinoplasty. The other two areas that are very common is the tip and also the ala, okay? So the tip may be droopy or too big, boxy, that we can, with sutures on the inside, make it thinner, make it a little bit more upright instead of drooping. And also the ala, there are some techniques to make them smaller and more appropriate to the rest of the contour of the face. Okay, so that's it, you guys. Thank you so much for the questions. Hope this helped understand a little bit about the muscle anatomy. And I wanted to also tell you guys the importance or go over again the importance of core workouts even after a tummy tuck. Okay, even though if we bring those muscles in, if you don't work out and keep the abdominal tone of those obliques and transversus abdominis, they're still gonna bulge, okay? So even if I bring it in and I suture back together, if you don't keep a healthy diet and exercise and keep your core strength, you are gonna see a bulging. And because the muscle tightness and the skin tightness is more in the bottom, that muscle bulging, you're gonna see it more in the top. So that's very common to see long term, like a year after. I see patients tell me the tummy tuck was very tight at first, but then I can see some bulge in the upper part. That is a combination of muscle weakness, not muscle separation. Muscle weakness and visceral fat, okay? So diet and exercise brings that in and stabilizes your core, okay? So don't forget that the importance of diet and exercise to keep your results long term, okay? See you guys next week on Tuesday Tips.